diagnosed kids in Peru. So the point is that with the right architecture, we can indeed scale AI at a very low cost. And what we need to do now is create those mechanisms to allow countries, organizations to come together and create both the roadmap as well as the financing that's responsible, that is needed in order to make that switch. There are, of course, other issues, trust I'm sure you'll get to, but I'll end in a very positive note. For the first time I can remember in 35 years in healthcare, we are not only now talking about the problems in healthcare, we have defined solutions that are scalable. So shame on us, shame on all of us, shame on government, if we cannot at this moment in time come together and create the pathways and the architecture to be able to do what we already know we can do, provide better outcomes for patients at a scale that was unimaginable a few years ago.
John Enrico, thank you. You've given us a lot to think about already. Roy, let me turn to you, because one of the comments I hear most often when I attend technology events is that, look, the area that AI will disrupt the most is going to be healthcare. So we say, where is it? I mean, you've been working on this, I've got to say, but we haven't seen the system-wide impact when it comes to some of those digital solutions, the scale that is sorely needed from here. So tell us your perspective. You see the current wave of technology. You've got all the pictures coming through from some of those unicorns as well. Where can we see some of these solutions best deployed to have impact?
Yeah, great question. And I will probably take it from two sides how I look at it. One is the glass half full and the glass half empty. Now, if you look at it from a negative side, you indeed say kind of the system is struggling to get the full benefits of AI because the adoption of AI is not easy. And that is already not easy within a certain practice of healthcare, because, as you know, there's a lot of different practices in healthcare, let alone if you need to do that at system scale. And that's what we need to talk about. How can we actually get healthcare moving at a system scale? And I always say, when you need to get the system moving, you need to get the different part moving at the same time. So yes, technology has arrived and is ready to be scaled. But we know as a technology company that technology alone can never do the job. It takes the clinical practice that actually appreciates what it can do for them, and actually also it's made easy to work with it in order to really get the benefits and then scale it. But even more than that, you then also need to get the financial system to reward that new practice. Because if you still keep rewarding the old practice, why would you adopt a new technology? Actually, it's more painful, you don't get the incentive for it. And then the regulatory side is also very important. And especially if you talk AI, you talk data, and we know where we are with regulatory on data, in particular data liquidity. So I think when we look at how can we move at scale, we need to get the system moving at the same time. Now, at COVID, and you refer to it, we were able to do that because we were single-minded, focusing on solving a major crisis that the whole world was rallying around. And then you saw that technology was brought to bear, systems were willing and able to change in weeks or days. They were mobilizing massively. Regulators were kind of adopting regulation to accommodate that, and actually financing schemes were changed in a day or a week to actually support that. So certainly everything was possible, but it needed that level of crisis to get the system changing. So whilst we're talking about a healthcare in crisis, maybe we don't actually act on it as it is in crisis. And that's, I think, what we see at a systems level. And it's a complex system. So that's when I say, okay, so there's a lot to be done to get us moving at a systems level, to get all these different actors lining up at the same way. Now, on the positive side, I do see that there is adoption in a lot of the practices. And if I look right and left, actually we have some leading examples, but also I see it on a country level. If I look to Singapore, I see it in the Nordics, in Europe, I see it in the Asian countries where you see practice really reinventing themselves, going digital first. So actually there are pockets where it's happening. And if I take one step back, actually the beauty of AI in healthcare, you can look to a lot of other segments in the world that are struggling to even find use cases for what AI is really going to contribute. We have tangible benefits that we can deliver with AI. If I look to imaging, one of the spaces that's the earliest, I think, spaces that this started to kind of really get an impact on, we have real tangible benefit. We developed one algorithm, SmartSpeed, that actually triples the productivity, so you can do double the scanning in an hour that you could do before. Has massive adoption. 1 in 4 hospitals in Japan use it already now. So that actually is landing, is being adopted because it solves an immediate need and people can work with it. So there are examples where it's happening. If you look to the accuracy level that we can get to now with the help of AI, if you look at how we can speed up. So I think that's an area, but at the same time, if I look to pathology, one of the very important areas in healthcare to get to complete patient diagnosis, only 10% is digitized. 90% is still the analog way. We have the traditional slides, they need to be kind of analyzed. There are not enough people to do it. So there still we are at the early stage of actually getting that into full digital kind of day and age. So I think there are two ways of looking at it. On a positive, we're moving, we have use cases, we have technology, and actually I think we are further ahead than some other segments that are still wrestling how to apply it and really get kind of the benefit from it. But to do this at scale is something that we still struggle with. And that's where we need to have the system to play ball.
Roy, thank you. And that dovetails neatly to Shabana, because the Indian market, where you have a large footprint, fascinating, because in the private sector there are pockets of encouragement, as Roy points out. So Apollo Hospitals is the largest for-profit hospital in India. You've been integrating digital and AI into your healthcare ecosystem across hospitals and improving access, telemedicine, for instance, some of the technology you have. Now, too often the public sector lags the private sector when it comes to digital. How does public health adopt some of the initiatives that you're rolling out already through your health system?
Well, basically, you know, seeing that Enrico and Roy were here on this panel, I kind of threw out everything that I had prepared for this, you know, in terms of what our hospital does, because it's there. Hospital systems now who can have the access, who have the people, the technology, the engineers, and the finances, can actually bring the best to bear for their patient. So let's move that on one side, and then and bring this conversation, you know, like we do at Apollo all the time. We bring it back to the patient, or we bring it back to the consumer. So how is AI really going to help you all? And then you can forget whether it's the government that gives it to you, or a private, or whoever gives it to you. You will consume it in the way that you find most trustworthy, because at some point people realize that they'll have to pay for healthcare, whether you have some amount of insurance, or you'll find ways. So you do that. Or the country itself, we moved, you know, in India from 1% of spending on healthcare to 2%. And it was a big shift for people to do for a developing country. Of course, the US, it's 15%. So governments really do spend money. And I think what AI will help, you know, if you look at it from the customer point of view, if we just look at the customer, first, I believe that we are not the only providers for you all, for a customer. A customer will go to Google, will go to Amazon, will go to all these who are also healthcare providers. Apple. So your watch is probably your best. And these are the ones who are redefining what healthcare can mean for you, because it has to be about you. It has to be able to predict earlier. It has to be able to give you the right nudges. And these are all the language that we learned ever since AI came into play. With that, we had a different language of fear and urgency when it was COVID, and then people came. So that was one, that you know you need it when you need it. But there's also this language now of how can I stay better? How can I stay well, live longer? And all this is what AI has been teaching you. And there's where you're consuming it, and you're going back to healthcare systems and saying, we don't trust you. You're not doing enough. You're too expensive. And so we've come back and said, we got to solve for this. How can we scale? How can we make sure? So now I have 22 million people on my app with this, and we're sending them nudges with this. So, you know, because in India, you can build beds, but it won't be enough. How do you keep 1.5 billion people, you know, healthy? And I think these are the conversations that we have fantastic partnerships. One is with WEF, that we did this Edison Alliance. And we just put, we used, you know, with American towers, we had digital dispensaries. And we could map people's healthcare that, you know, so women who didn't want to go to a healthcare center were coming, you know, or digitally. So they were consuming. So this is a sector that is really left out in many countries, especially India. Another thing is, and I can go on, but let me close it by saying the cost of looking after them for preventive healthcare was $8 for us in India. It was $8 for the year for testing, for keeping their records, and for giving them basic medication. So I think that this is a huge, this is a solution for the disease burden of the world. So I'm bringing it back, front and center to the patient.
It's an incredible number on the cost of healthcare. It's fascinating. Nicola, let me turn to you. PATH is working in more than 70 countries to improve health. So unique perspective when we talk about health equity and where to go from here. Now, tech has promised to pretty much democratize just about everything, but we haven't really seen it yet when it comes to health equity. Realistically, how much impact do you think digital and AI will have when it comes to the next 5 years in achieving the Sustainable Development Goals, at least for health, especially now that the US is out of the WHO as well?
You were throwing that in the end.
Yes, I was. Someone was waiting.
It was not in the script. I was afraid you were going to ask me about, since I am from Denmark but live in the US, I thought you would ask me about Greenland, but you didn't.
Oh, I can.
So I'm happy to answer the other question. No, I think we are way off track on the SDGs. That's not only the health SDG, and that's not very good for the world. I think without a digital transformation happening 10, 20 years ago, we would be even further back. So I would say I would probably divide the answer into one AI and one on the digital transformation, excluding AI. So I think many countries in the global south and the countries we work in has taken on digitalization of the public healthcare system. And of course, as the backbone of their information systems for addressing epidemics, but also non-communicable diseases. So that drive towards having a health system where you have the information that you need, a supply chain system with availability of data, of access to medicine and so on, is really something that countries have been able to integrate into their system. So that has given them a good foundation to move forward, and also deploying AI at a later stage. But for me, digital is always, the perspective is as an enabler. It's an enabler for health outcomes. So if you look, for example, health outcomes, also other areas, of course, but if you look at under 5 mortality rates, we know that vaccination is critical for young children. So how has digital immunization systems, patient records, really helped increase the vaccination rates around the world and in the countries we work in? So those are the kinds of investments in digital infrastructure and health infrastructure that has helped many, many countries. And I'm not seeing that going away in the next 5 years. I'm actually seeing more countries, and you mentioned India, telemedicine to access for populations in rural areas that doesn't have access to health clinics, health facilities. It's a big opportunities there to roll out telemedicine further over the next couple of years. So I think that still is giving us some promise that we will reach more people by using digital systems that enables us to reach those people. It has to be combined with access to medicines, affordability of those medicines, access to doctors, nurses, community health workers that needs to be equipped to actually deal with those patients, but also being able to utilize those systems, which is going to be essential. And we need also to continue the political will. So every government around the world needs to take on digital as an enabler for a strengthened public health system in the country. Without that political commitment, it's very hard to roll out public sector reform, including establishing a digital infrastructure. We've seen this in the G20, in India, for example, which had digital as one of the key priorities. Brazil, South Africa, next this year, they're going to talk about universal health coverage. Primary health care is going to be a priority. And primary health care, universal health coverage needs digital infrastructure to work. So I'd say we're going to see some influence on the SDGs, on the digital transformation. On the AI, I think for the vast majority of the populations around the world, which lives in the global south, it's not going to move the needle a lot. We are currently deploying AI technology in 3 countries in Africa in a project with the Gates Foundation. We are very grateful for that partnership. It's the first test of how AI can be used in clinical decision making by community health workers in rural areas. So we're going to apply AI learning and see if they can actually use that when they see patients, integrating it with the regulatory system and so forth in the countries. So we're very excited with this pilot, but it's not going to deliver any major results in the next couple of years.
I don't want to go too far off script, but I do want to ask the other panellists about the US stepping out of the WHO and whether you see an impact here, along with the massive investments we've just heard this week, $500 billion going into AI investment in the United States. As we talk about digital and AI being an enabler, the infrastructure being very key here and what impact it has. Shabana, do you want to touch on that? What the US is doing, stepping out of the WHO, but building its infrastructure and technology. Does that have an impact, leaving a big divide between, say, the United States and India?
I hope there's no pandemic in the next 4 years or any critical major event. But having said that, I think that WHO does play an important role in unifying, but I don't think it is the only thing that it's not going to take down, make or break India's healthcare system, frankly. So it helps to be, we like to be part of bigger networks. It helps in that aspect. I don't think that we're at a stage that we depend on them.
Roy.
If you think about what I just said, that we need the systems approach, actually, I think we will miss certain support and oversight that a more neutral body like the WHO can provide to kind of cross-learning. The other one, and we discussed it today, if you talk about systems approach, you need to have public-private partnership, but actually there's also a lot of public-private and philanthropic or kind of partnership that is going into healthcare, and we need to orchestrate that. Now, again, WHO has played an important role, including sustainable financing, because financing is a big part of healthcare. And especially if you talk about health equity, I think WHO has played an important role as well in terms of making sure. So I think we will miss out if WHO gets stronger. I also agree it's not the only role or it's the only actor. So in that sense, kind of, we will need to, as a system, pick it up. But it's something that I think we will miss if they would be weaker.
John Rico?
There isn't much to add there because this is fresh. We'll have to see how it unfolds. What is clear is that other organizations will have to step up and will have to create new partnerships. And sometimes that does give us an opportunity to do something a little differently from the past. And a fast-moving space that is the digital transformation of healthcare, that is not necessarily a bad thing.
Well, thank you all for taking that question. I want to talk more about enablers. And Roy, if I can come to you, we know it's not enough just to have good technology. If you lack the capital, you lack the incentive scheme, it's skewed towards short-term profit, for instance, switching costs. And of course, we saw that with even just digital health records. There was switching nightmare because a lot of medical systems just didn't want to pay for that upfront cost of switching medical records online. In terms of what we see here, too much regulation, you pointed out as well. What are we chasing in terms of systemic impact on health? Now, Philips has been involved in various initiatives here, tackling value-based healthcare, health systems, sustainable resilience. What is the most important public and private enablers that we need to focus on globally? What can you tell us about these enablers?
I think, and I said it before, if you want to really leverage the power of AI, you need to free the data first and actually make the data flow. And
so no silos.
And do it around the patient. So the patient data need to be put in the hands of the patient first, or put in the hands of kind of the bodies, governments that actually can orchestrate it in the right way. Currently, data are locked up in silos across the world still. That actually makes that you cannot travel. If you're a patient, it's very hard for you to travel with the data or to kind of keep them. And if you want to enrich them and put the AI on top, I think so. That's for me the data And the data challenge is one big enabler to unlock power of AI. The other is kind of how we train the algorithms with the right clinical data. As you know, the common algorithms, they leverage the web to get their knowledge from. We need actually to train it on proprietary data. And also there, if you look kind of what are the data sets that we can train on, we know they will get more powerful if they get more data. Currently, you're still limited in some of the data sets that we can use to train them. So I think the better we can train them, expose them to kind of the right data sets, and also integrate those data sets. Because I was talking about imaging, pathology together, with genomics data together, that actually gives you a really full view of the patient and its situation. Now, there are not a lot of kind of current bodies that I can see that can do that in an easy and digital manner. So how can we kind of really accelerate that journey? And there's a lot tangibly that is being done that you can do. So that I think is another kind of critical enabler. And then I would still, next to the patient, I would also still put the user, the provider at the center. Because if the nurse doesn't want to kind of adopt it because they're afraid of it or it's not user-friendly, we will not get the benefit. If the doctor thinks that he's going to be replaced by it, which he should not, because I think it will actually enhance, they will reject it. And we were also discussing earlier today, we have multiple generations of doctors and nurses that actually we need to deal with. So how do you actually get them along in the journey, educate them, train them, bring them to ease with it? I think one of the big changes, or I think the benefits that healthcare has, I think in healthcare nobody should be afraid that AI is going to take their job, because we don't have jobs enough to be filled with people in healthcare. The biggest kind of problem for healthcare is that we don't have kind of people to take care of the people. So actually healthcare has to come to the rescue to actually fill the void that actually that there is. And let's do it on the tasks that actually they don't want to do, the routine tasks. If a nurse spends 15 minutes an hour on admin tasks, let's take them away. If a doctor has to do prescription and kind of a lot of reporting, let's actually go there first. Those are routine tasks that we can actually really go after hard with AI. And that's a quick win, is also lower risk. Now, the closer you get to precise medicine, diagnosis, treatment, intervention, kind of AI-guided robotics that kind of take over, then you get into pretty exciting areas, which I think will come. But we better train them well, we better test it well, and we know what we do. So I think there's a lot of application area, but let's start with the basics. You need to have the data set, you need to have the right, properly trained algorithm, and you need to have the patient that sees the benefit and the providers that know how to use it.
I think that's a fascinating point about the data. It takes me back to a conversation I had with Tim Berners-Lee about who owns what when it comes to data. And of course, a very basic example being social media, that if you're with one platform, you can't transport your data elsewhere. He's kicking along the next level when it comes to all data, not even healthcare. Perhaps that data can be transported no matter what it is, whether it's driver's licenses, whether it's healthcare, identity. That is a fascinating point, that data could be transported by the patient. Does anyone else want to come in on that?
So I kind of agree with you, but I think that just giving data freely to you guys, unless you're in partnership with us. So there has to be constructs of good partnerships. I mean, we've done some great things with you all. You can build better algorithms when you have the right, when you're working as partnerships. If you're just going to let all your data out, you don't know what will happen with it, the hallucinations, all that, you know, there's patient safety, there's your, this thing that the data belongs to the patient. And so all those, you know, we come up with ethical issues. So it's not that simple that you can just let data flow freely. This will be regulated. It'll always be a challenge. But I think what we now see is really good partnerships, because, you know, just imagine that we did a project with Google, just like you did, you know, what you had explained, that you can, that they can actually look and see, you know, from, they can see if a patient has TB way ahead, using digital tools. So then you can take it out to large population, because so many people in India are vulnerable to tuberculosis, and that's dangerous, you know, because of the antibiotic usage. So for that aspect, these are the things that you can come and collaborate on. So yes, I do think that the data is important, should flow, but not that freely.
John Rico, let me turn to you around responsible technology here at AI and trust. These are big issues, particularly when it comes to the healthcare system. Nobody wants bias in the system, and of course, nobody wants any potential harms to come to patients by unlocking some of this data. How do we strike the right balance here between innovation and responsibility, particularly in the intelligent age of AI?
Yeah, so we clearly are not there yet, and we should be clear-eyed about why we're not there yet. And I would argue that healthcare has some responsibility, governments have some responsibility, we all collectively have, is that we seem to be in a position where everybody wants to dip their toe into the water, but unless the temperature is exactly right, they don't want to jump in. And that is not good, because healthcare at the moment is not in a good place. And therefore, even if the temperature isn't exactly right, there still is a tremendous amount of benefit from getting in and then making it better. I personally would not want to have my healthcare in some specialties without AI, because I firmly believe that I will get a better outcome. So we need trust. We have to do a better job defining what that means. Inadvertently, we created the impression that trust means that everybody who uses AI has to understand exactly what's going on, no black boxes. Well, that's not realistic. I do not know of a single X-ray technician that uses one of Roy's machines that understands truly what goes on in the machine. But Philips, plus some sort of authority, have said it's okay to use, and what it tells you is actually what is going on. I'm a big proponent for assurance labs. Private-public partnerships that come together that allow anybody to take their algorithm and be able to say that it's fit for use and it does what it says it's going to do. In our platform, we call that validate. We recently had an example of a company that developed an algorithm to diagnose epilepsy at home. Epilepsy affects about 1% of the population. It's a big deal. They ran their algorithm through our platform, and we found it did well overall, but there was a subset, one subset in the population that didn't do as well. So they had to go back, arrange that, and they now have FDA approval. By pushing the responsibility to independent groups that then are able to then verify the algorithm, but more importantly, come back to it over time. These are self-learning algorithms. You can't lock them down. So you can lock them down, and you have to come back to them, you have to come back to them, you have to come back to them. If you do that, I truly believe we will start getting back the trust that we need in order to get back to what we're all talking about, the patient. It's not in the patient's best interest to not trust. Unfortunately, they should not trust at the moment, but it's up to healthcare to install that trust, so we have to stand up to do it. And one way to do it is to make sure that providers also trust, because at the moment, providers don't trust either. And I am a firm believer that the way to do that is to decentralize AI. AI needs to be not run from a centralized place. It has to be run within clinical departments, within units in companies, because you will learn more, and you'll be able to learn about AI from your coworker, from the person next to you in the cubicle, from the physician that is talking to the patient in the bed. And that's where I think you start building those elements of trust in the healthcare system that then also translates into patient trust.
Nikolai, do you want to come in on this? Because the different countries you work around, of course, different levels of trust, and we know that this is a very personal aspect of our lives, to be trusting people with our data, to manipulate it, to crunch it, to try and target us with solutions. How do you think the approach should be here?
It's interesting because the US, of course, has the main technology companies that are driving this technology. But I'm actually not sure that US is going to be #1 in terms of applying the technology because of the risk in the US in terms of lawsuits and so forth, which means that, and also the way the health system is set up, there are other more trust-based societies where I think there is a better trust between providers, physicians, and patients. And maybe I would start in looking at those societies where you already have a strong established trust between the system and its population, And that, so people in the US don't go often to the doctor, of course. We know that because of finance and because of lack of trust and so on. So I do believe that the deployment and is going to happen maybe somewhere else where the trust is different. I don't want it to happen in a country in Africa where there is no guardrails, of course, because that's where it can go really, really wrong. So that's why I talked about this project we're doing now to see under which conditions can this actually work, under which regulatory environment, under which health education program can this actually work, and how do you build that trust among the patients and the community where you are delivering care. So it needs to be deployed in a place where there is already trust for it to show the results that we want to show, that this can actually help address some of this workers' shortages that you mentioned, which I truly believe in, that it's not going to replace work, it's actually going to solve some of the gaps we have in the countries that we work in terms of providing healthcare advice, education and so forth. So
my mind went so many places then when you were speaking. One about the US being the fast lane when it comes to AI, but not when it comes to health and AI. That was correct.
Yeah,
right?
That's what I think.
And the other point, that if the continent of Africa is getting access to technology, perhaps at a subsidized price, then maybe state actors are involved in extracting the data from some of these core systems.
Yeah. So there are many complexities in this, and we have to know what we're going into, and we have to know the environment and the country that we work in, because it can go wrong. So, yeah, that's my point.
Roy?
Yeah, maybe a few comments. So first, and I think on the data liquidity, what I was trying to say is kind of, first we need to make data digital. So in Germany, 10% of data is still fax. Hard to do. Digital pathology, 10%, yeah, it's still fax. So it's hard to do AI on fax, right? If you have pathology data, 90% is analog, right? You cannot do AI. That was my point on data. Secondly, we have a responsibility, right? Enrico and myself have been part of the National Academy of Medicine for self-conducting mechanism on responsible AI. So I think we also need to be able to look into the mirror every day to say, okay, are we doing the utmost? On the other side, we also need to be fair to AI. We should not ask more from AI than we ask from a doctor. And we do. On the accuracy level that we test, we actually put levels in of accuracy to AI that actually doctors do not meet. The consistency of what AI can deliver versus what the consistency is that if you go to certain doctors' practices is not always there. So I think we should be at least where doctors and better, but we should also not say you need to do the kind of impossible, because we would wipe out all the benefits. And take the patient perspective. I can tell you, if you're that late-stage cancer patient fighting for the ultimate resolution that's not yet there, you will want AI to explore the world for the last resort that you are craving for to help you survive. So I think there are different perspectives in terms of, and that is kind of what fairness is about in AI. I think it's extremely important we do it right, we get it right, but we should not curve the potential of this potential revolution in technology and how it really can progress healthcare and the outcomes of healthcare. And still, we need to do it in a responsible way.
True. Shabana, let me come to you on some solutions. Avenues here for possible solutions, international collaboration, partnerships between healthcare and tech. What are some of the solutions you see here?
So one is that I agree with Roy that when, these are the collaborations that will bring together the best in, because it can't be done just with the hospital system. But when you collaborate with, whether it's, we just opened in the state of Andhra Pradesh, in my father's village, we have a medical college, and the University of Leicester just came day before yesterday, and we have a center of innovation with this. So I think that's something that AI can do, that it's not about a geography. You can put it there, you can get these collaborations together, and these partnerships don't need to be this high-end exclusive in bubbles, but we need to we need to put more of them around the world. And the more that we have, the more that people can, that you'll get those. And I agree that you can't expect more than what a doctor does, but a better perspective for, I mean, or actually a conjunct to what you said, is that the reason that we did our clinical intelligence engine is because, you know, when you go to doctors, each one will have a different interpretation sometimes, and to get there. So what we can do is that 80% of it, if AI can actually smoothen the process for a patient, it actually makes their life so much easier, understandable, and then that 20% has to be done by a doctor. The validation has to be done by a doctor. It makes him more productive. He can do more cases, and so and the cost comes down for that particular doctor visit. And the third part of it is that it just gives a much better experience, because then everything is there. That instead of a doctor, you know, the 15 minutes he would have spent earlier, this actually makes it so much better.
Right.
So.
Shabana, thank you very much. We are running out of time, so I just want to whip around the panel and get some action here, some takeaway. If I can start with you, Nikolai. Based on everything we've just discussed here, if there's one thing that you feel should be done between public and private collaboration in the next 12 months to advance what we're talking about here, digital health on a global or regional scale, what would it be? You've got 30 to 40 seconds.
Yeah, I think standardization, interoperability, making applications that will be easy to integrate into public systems, because innovation is very hard to take into existing health information systems. So anything that private sector develops needs to be easily integrated for it to be really usable for integration into the system and actually benefit the population.
John Rico, same question to you. If there's one thing that you feel could be done via public-private collaboration over the next 12 months, what would it be?
We need to move healthcare from a pipeline to a platform model. We need to do that by creating defined pathways that are coupled to financing models that allow countries, wherever they are, to know what the next step is, and then to make the choices that allow then patients to have better care, deciding to either partner with somebody else, ask solution developers to develop solutions, or develop their own solutions. If we do that and tackle that underlying problem, then not only will patients benefit, but the system itself will continue to self-learn and create truly better outcomes for all.
Shabana.
I'd go all in reskilling, upskilling, and teaching with this in the next 12 months if I had that, because that wave is going to come. For us to take, to seize that moment, we need to have multiple people who can actually take charge of this. So skilling, reskilling, super important.
Roy?
I think from the adoption, because it's all about how we drive adoption, and I think rallying up the financing with the regulatory support and how we kind of have the support to the practitioners, I think will define how AI will find its way into the daily practice.
You're also succinct, which is amazing. We actually have time. We might have time for a very quick question. Does anyone have a... Here we go.
You're at Australia. You have insurance. Yeah. Stand up. Okay, sorry. I actually, in the meantime, asked AI the question, which country is really collecting all available health data in the central system? And the ChatGPT answer is like, okay, Switzerland is the only one I found, but many people, many opinion claims that actually they claim to have this data, but nobody have seen this data. So I will ask you the same question. So have you ever come across the country which really collects everything, including, you know, I mean, röntgens, resonance, etc., all the health data of the people in the central system?
Can anyone name one?
I understand the question.
China?
I would say that's not the important question. The important question is
Taiwan, China.
data in a position that can be used. So there are several countries that are collecting data. They're putting it in containers that are not conducive to digital first. I will not name particular countries because of what I just said, but I'll let others chime in.
Roy, 10 seconds.
Yeah, so maybe one great example actually is Indonesia. So Indonesia, what they did, actually, they had the COVID app. They kept it alive, where they actually, you know, in COVID, everyone had their own COVID app proving that kind of they were vaccinated or not. They used that, and by now, they kept that. They actually have it for every inhabitant of Indonesia, and every single test, medical procedure is loaded on that app.
Right.
So there they have it on that app in one point of
Nikolai, you wanted 10 seconds?
No, I just say, I think it's a good question, but the question, you don't need to have all the data to actually deploy digital technologies and do a digital transformation utilizing AI. So in the perfect world, you will collect all these data,
right,
but 90%, 80% would also give you a good start.
Right.
As long as you focus in the areas where you collect the data.
Shabana, you were whispering China?
No, I like everybody's, and we're out of time. So.
We are out of time. Thank you so much for your participation, for being here. Thank you to our panelists.
You were great, including on timekeeping.
Thank you.
Oh, nice to meet you.